Welcome to the Advanced Therapy Center in Orinda, California. I'm Dr. Candia Smith. I'm a doctor of mental health, a licensed psychologist, and I'm certified in the practice of neurofeedback. Today, I'd like to show you a technique for treating trauma that we've been using here at the Advanced Therapy Center for about 3 years. Today, my focus will be on helping adults who were victims of childhood trauma. However, these techniques can be used with any kind of trauma, and it's my hope that someday these techniques will be available in primary care physicians' offices, fire departments, and police departments. Childhood trauma gets locked into our nervous system. For the developing child, the need to protect and defend can be so important that their ability to rest and restore is hijacked. I'm going to tell you a little bit today about the autonomic nervous system and explain to you why I think that using the NeuroField suite of tools for what I call the Vagal reset protocol can be so helpful in restoring a capacity toward health in a previously traumatized individual. The autonomic nervous system is called that because it's fairly automatic. We don't have to think about it. It just takes care of us. It has two major parts: the sympathetic, which is used for flight or fight, defense in the face of threat, and the parasympathetic, which, when it's not being overwhelmed by the sympathetic nervous system, runs most of the organs in our body and our immune system. It's also responsible for helping us calm ourselves so that we can experience intimacy and bonding. The fact that the parasympathetic nervous system can be hijacked by the sympathetic nervous system, I think, is what underlies the dire findings from the ACE trauma study. The ACE study, which stands for Adverse Childhood Events, was created by Dr. Folletti at Kaiser in the 1990s. Dr. Folletti interviewed 1,700 Kaiser patients and interviewed them about their current health status and their history of childhood trauma. He came up with some amazing statistics. Compared to an ACE score of 0, having 4 adverse childhood experiences was associated with a 700% increase in addiction, a doubling of risk of being diagnosed with cancer, and a 4-fold increase in emphysema. An ACE score of 6 was associated with a 30-fold, 3,000% increase in attempted suicide. As you can see from this diagram, there are hypothesized scientific gaps between the experience of childhood events and the social, emotional, and health risk behavior consequences. I believe that those scientific gaps can be explained by understanding the role of a deregulated parasympathetic nervous system. The Vagal reset protocol is a simple procedure that could be taught to any medical provider or even first responders. It's the brainchild of several people in the NeuroField community. I want to thank nurse Jamie Moore, chiropractor Peter Deshane, and inventor psychologist Nicholas Dogres for their contributions. We work directly on the course of the vagus nerve using pulsed electromagnetic field, PEMF, energy. This nerve, the 10th cranial nerve, runs from the brainstem to virtually every organ of the body. It is the longest of the cranial nerves and has both motor and sensory functions. The word vagus is from the same root as vagabond, expressing how much this nerve wanders through our whole body. There are 2 versions of the vagal reset. Version A uses the heart's feedback to choose what PEMF frequencies feel healing, calming to the vagus. Version B uses the known frequency of a healthy parasympathetic nervous system delivered with both PEMF and transcranial alternating current, TACS. Which version we use with each individual is chosen based upon a client's history, sensitivity, and responses. Both versions use the same coil placements for PEMF. PEMF emitting coils are placed at the exit of the vagus from the skull and down the course of the nerve. We cover the 1020 sites, a system of EEG placement, T3, T4, T5, and T6 with 4 coils from one unit of the NeuroField X3000. With another 4 coils from another X3000, we cover the supraclavicular notches and the center of the bottom ribs. In this way, we follow the vagus through most of its contact with the organs of the body. I believe version A is generally more useful with traumas that have severely taken away control and choice from the child. In version A, the body chooses what it needs. We monitor heart rate variability, HRV, in response to exposure to 7 different sets of frequencies. These 7 sets were discovered by Dr. Paul Nogier and reflect 7 different organizing principles of the body. A set is chosen by having the largest increase in heart rate variability. The chosen set is then used, and heart rate variability is monitored to select the frequencies within that set that have the largest calming influence on the client. The final frequencies are then delivered for at least 20 minutes while the client relaxes, enjoying music, a video, or simply meditating. Version B uses transcranial alternating current from 0.14 to 0.4 Hz delivered through the mastoid processes. These frequencies have been studied to be part of a healthy parasympathetic nervous system. The coils then emit these frequencies and their harmonics. The client can meditate, chat, watch a movie, or listen to relaxing music. This procedure is run from 20 to 40 minutes. I want to thank you for watching our video today. For more information, go to advancedtherapycenter.org and NeuroField.org. And remember, no matter what you're up against, if you keep working on it, it gets better.